breast MRI. Joining me now is radiologist Dr. Lynn Gaden. Dr. Gaden, thanks so much for joining us.
Thanks for having me.
Earlier in the show, we talked about mammograms and mammography being the primary way that people check for breast cancer. Tell me how breast MRI differs from mammography.
In mammography, we use radiation to develop an image. In ultrasound, we use sound waves. In MRI, we use a combination of contrast, so we put in an IV, give contrast, and then place the body in a magnetic field, and that creates an image that we use for interpretation.
Is it better than mammography?
Well, like everything else in life, it has pluses and minuses. It is a lot more sensitive in some ways. Some types of cancers show up better and earlier than they do on mammogram. However, not all cancers show up on MR either. And some cancers, some types of very early cancer may even show up on mammography earlier than they do on MRI.
Who would breast MRI be better for?
Well, we're using it currently for women who've been recently diagnosed with breast cancer to look for extent of disease. That helps the whole team in planning what type of surgical and medical oncology treatment the patient may need. And also we're using it, some patients who have been newly diagnosed with breast cancer also have second cancers that we didn't previously expect. So we're looking for finding additional cancers that were previously unsuspected in those women. Now, one of the things that we're doing is looking at groups of women, stratifying risk groups. Not everybody has the same risk of developing breast cancer, and as our knowledge base grows about genetic abnormalities, we know that some women are at particular risk of developing breast cancer. Those women who have a genetic mutation are very high risk, as much as 85% risk over their lifetime of developing breast cancer. So as we stratify risk groups, those women may actually benefit from having routine mammography and MRI studies looking for early breast cancer. The people who have genetic abnormalities actually have cancers that grow faster, and those tumors are actually more aggressive. So we need to be more aggressive in our search to find those at an earlier stage.
Dr. Gaden, thanks so much for joining us.
Oh, well,